channel. When the sodium channel opens, there is going to be slow influx of sodium into the cell. This slow influx of sodium is going to be producing increased positive charges inside the cell. So, positive charge tends to rise up inside the cell. At one point of time, the potential inside the cell will reach the threshold potential. What is the threshold potential, guys? The potential which is required to open the calcium channels. Once it reaches the threshold potential, calcium channels will be opened. All the calcium will gain entry at a faster way, right? There is more calcium which is gaining entry into the cell. Because of that, there is going to be more positive charge which is accumulated inside the cell. At one point of time, the cell can't withhold this much amount of positive charges. It needs to let out all the positive charge. So, what it does, it has a potassium channel that will be opened. All the positive charge will be let out from that cell. Clear? As the positive charge has been let out, the potassium is constantly going out, right? The potassium is constantly going out, going out, going out. There is no resting membrane potential. Which impulse is going to be closing that potassium? Nothing is there. Because as I told, pacemaker cells or SA nodal cells has got no resting membrane potential. There will be constant let out of potassium, but at one point of time, the positive inside the cell will be very much lesser. It will cause hyperpolarization. That hyperpolarization will stimulate the opening of the sodium channel. Is that clear? So, what is the sodium channel? How the sodium channel is getting opened up, buddies? It is the hyperpolarization. That's why this sodium channel is also called as hyperpolarization activated sodium channel. So, what happens inside a cell? Inside a pacemaker cell, consider we have a normal human being. You're just zooming in into the chest region. You're zooming in, you see the heart. You zoom in into the SA node, and you zoom in till further to see what has happened inside the cell, and that is what the diagram which I have explained here is. So, what has happened here? There is going to be sodium channels will be opening, slow sodium influx. At one point of time, cell will land up in threshold potential, fast calcium influx. At one point of time, I have to withhold that, all the potassium will be let out, from that. Again, there is going to be sodium influx. This is called as the action potential. I have drawn it of how it is happening inside the cell, and now I am going to put it up in an action potential graph. Clear? Now consider we have the y-axis, that is your potential, and we have the x-axis, that is your time. As I have told already, there is no resting membrane potential for the pacemaker cells, but there is a threshold potential. Consider I am going to draw the threshold potential at this level. Somehow, let's start with the sodium channels, right? So, at the lower level is where your sodium channel is going to be opened, right? Hyperpolarization is going to be activating it. So, there is going to be slow influx of sodium. Once it reaches the threshold potential, what will happen, buddy? Calcium influx tend to occur. More calcium influx, there is going to be a rise in the graph, and once it reaches the peak, the calcium will be closed and all the potassium will be let out, everything will fall down. It will be falling down and down and down. At one point of time, there is going to be opening of the next sodium channel. The same sodium channel will be opened for the next action potential, and that is where again there is going to be slow sodium influx. Again there is going to be calcium influx. Again there is going to be potassium influx. This is how an action potential will look like in terms of a pacemaker cell bodies. So, the current which is produced because of the influx of that sodium channels, they are not just slow sodium influx, not fast sodium influx, slow sodium influx. The current which has happened from the lowermost part towards the threshold potential, the current which is produced because of the influx of sodium inside the cell, that current will be called as funny current.